Hi, I'm Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. The COVID-19 pandemic continues to disrupt normal life in the United States and worldwide. As we go to the press today on June 30th, 2020, more than 10 million people have tested positive for the virus and over 508,000 died worldwide. In the United States, more than 2.6 million people have been affected and over 126,000 died. The JVS journals bring you a large collection of papers on how COVID-19 has affected vascular patients and how tens of thousands of healthcare professionals deal with this huge problem affecting mankind. I am pleased to introduce to you the September issue of JVS and highlight 4 outstanding papers which are freely available for the next 2 months. The Editor's Choice article for this issue is titled Results of Fenestrated and Branched Endovascular Aortic Aneurysm Repair After Failed Infrarenal Endovascular Aortic Aneurysm Repair. It was written by Andres Schenzer and colleagues participating in the Aortic Research Consortium. This was a prospective analysis of 6 physician-sponsored, non-randomized investigational device exemption studies that included 893 patients who underwent fenestrated and branched endovascular aortic aneurysm repair. 18% of the patients underwent previous EVAR. The 30-day major adverse event rates and mortality did not differ between the 2 groups. Freedom from type 1 and type 3 endoleak, target artery patency, and freedom from reintervention at 1 year did not differ between groups. This study confirms the feasibility and safety of a fenestrated branched EVAR after failed EVAR. Our next article is titled Rapid Increase in Hybrid Surgery for the Treatment of Peripheral Artery Disease in the Vascular Quality Initiative Database by Arash Fayardoni and colleagues from the Yale School of Medicine in New Haven, Connecticut. This is our CME article for this month. This VQI study demonstrated a 5-fold increase of hybrid surgery performed from 2010 to 2017 as a lower extremity revascularization procedure. Hybrid femoropopliteal procedures had better perioperative outcomes compared to open femoropopliteal bypass. However, the 1-year outcomes were comparable between the 2 procedures, suggesting that hybrid revascularization of femoropopliteal disease should be performed selectively in high-risk patients, owing to its superior short-term outcomes. The third article by Galito and co-authors from Bologna and Parma, Italy is entitled Off-the-shelf multi-branched endograft for total endovascular repair of the aortic arch. In this retrospective single-center study, 17 patients underwent urgent repair with the Cook Zenith T-branch device for contained rupture or symptomatic aneurysm in 24% for each, and for a thoracoabdominal aortic aneurysm that was 8 centimeters or larger in maximum diameter. Technical success was 82%, but adjunctive and complex intraoperative procedures were needed in 87%. 6% had spinal cord ischemia, and 30-day mortality was also 6%. 1-year survival of these patients was 82%, and freedom from reintervention at 1 year was also 82%. The authors concluded that the off-the-shelf multi-branch endograft is safe and effective, that can be used for urgent endovascular thoracoabdominal aortic aneurysm repair. The fourth article is the impact of age on in-hospital outcomes after transcarotid artery revascularization, TCAR, Transfemoral carotid artery stenting and Carotid Endarterectomy by Hanadakur Aridi and co-authors. This VQI registry study compared outcomes of 3,152 procedures first to those of more than 6,100 carotid endarterectomies. There was no difference in in-hospital stroke or death between the groups, but TCAR, as expected, was associated with significantly less cranial nerve injuries. When results of TCAR were compared to transfemoral carotid artery stenting, then in patients who were 80 years or older, TCAR was associated with a 72% reduction in stroke risk and a 65% reduction in in-hospital risk of stroke or death. So these results suggest that TCAR is safe and effective procedure in elderly patients. These were 4 of the several excellent papers from the September issue of the JVS. You can download them free of charge at www.jvascsearch.org. Enjoy reading all JVS journals and let us know if you have a comment or a question. Thank you for watching and see you next time for the highlights of the October issue of the Journal of Vascular Surgery.